Chalo, anyway, very good afternoon. So last class we started with noble metals, okay? Because of some technical issues, not able to manage with the PPT. So we'll quickly switch over to the traditional method of blackboard and chalk, okay? Anyway, so what did we, I know PPT will definitely have an edge because you'll be seeing the images. And I've also been insisting, as a teacher, you should have that quick adapting nature, because when the technology gives in, you can't skip the class blaming the technology. Okay, so we'll still try our best to make it interesting. The only thing is you'll be missing the colorful Google images. Okay. But we'll try to manage. Okay. So we'll quickly look at the recap of what was done. And if I remember, we spoke of, or we introduced to noble metals, and we tried to understand why so many ways of learning materia medica, and what exactly the group materia medica means. And accordingly we had discussed. Okay. So that was done in the last class. And three very important points were spoken. I'll try to recreate the PPT, what I had done. Okay, so three things were planned. Three things we did about noble metals. One, we spoke of the introduction. And the second thing, we spoke of the pathogenesis, very good. And the third very important thing we spoke was elements from, very good. So this was your first PPT, first slide. Okay, so we'll try to understand this. Now what did we discuss under the introduction? Under the introduction, we try to understand what noble metals are, their basic properties, and the common noble metals we use in homeopathy. So this is what we had planned, or we had understood. And then quickly I spoke to you about the pathogenesis. So where do you see the noble metals acting? Nervous system, very good. And see, this is important because this will take our class to the next level. Nervous system, very good. Glands, good. Respiratory and mucous membrane. And we also realized that it has affinity for GI and respiratory. Good. Then, very good. Reproductive organ. Both male and female reproductive organs. Good. Anything else? Connective tissue, circulatory tissue, a circulatory system, and very close to circulatory system is the heart. Heart, okay. See, having a very good understanding of pathogenesis makes our next class more easy. And ailments from? Disappointed love, grief, sexual excess, masturbation, and total 6 images. One image had on your extreme left was loss of position. Ailments from loss of position. And one more thing I had added, which was not there in the PPT, was bad effects of mercury. Bad effects of mercury. And I also told you the physical appearance. They are generally lean, thin, emaciated. Mainly the argentamate. The arms, they generally look lean, thin, emaciated. Okay? And we also spoke of the miasm. What is the predominant miasm? Psychosyphilitic. Okay, psychosyphilitic. So this is the first slide. And in the second PPT, what I was planning was when you look at generalities, we look at see, I have told you in many classes that group study we generally do under 3 very important headings, and headings have increased as we have evolved with teaching. So the first important heading will be the introduction, and second thing is the physical generals, group characters, and third will be the mental generals, and of course the clinical utility. And one more we are using it in this class is we will be trying to differentiate different noble metals. Okay. So now, what could be the common physical generals that you can think of? Or what could be the headings? You give me the headings, we will have a discussion and we will try to understand. Very good, thermals. Okay, good. I had a slide prepared for thermals. Good. Side affinity, beautiful. This was my first slide in the PPT. Side affinity, good. Then side, thermals, anything else? Okay, tendencies. For example, dianesis. Are they hemorrhagic? Are they glandular? Are they rheumatic? Good, possible. Okay. See, before you start giving more answers, we will continue with the presentation and you can also start contributing so that it will be two-way. Okay. Now when you come to side, our focus for today's class is noble metals. Okay. So where do you see the noble metals acting? So luckily we have only two sides. So it will be easy for you, left, right. And more luckiest thing is we are discussing only four noble metals. So you put two here, two there. So they are also happy, we are also happy. Okay. So where do you see think of the noble metals acting on the left side. Aram, good. Platina, okay. See, atom is right sided. Palladium is right sided. Okay, I'm talking about predominant. Aram might have an affinity for left side, I have nothing against it. But aram, for our understanding, when I read the source books, it has an affinity more towards the right hand side. Okay? Left sided noble metals. Argentum, met and platinum. Argentum met can also have an affinity for right side. You agree? We discussed in the last class, argentum met affects right, ovary and left testis. Correct. So argentum can have, did I tell it the other way? Okay. Argentum can have the affinity for both. We'll discuss this. So when you are looking at side, platina, argentum met, left sided. When you are looking at the right, palladium, aurum and of course argentum met. So this is the side affinity. We'll go to the next slide. So what was that we were discussing is thermals. Okay. So I had two images taken from Google. In one the lady is feeling cold and in the other one the lady is feeling hot. So simple. So which are all the noble metals which are chilly and which are all the noble metals which are hot? Chilly, hot. Platina, hot. Good. Platina. Aurum, chilly. Okay. Argentum. Okay. And we also have palladium. Okay. See, palladium we don't have much of information. So let me explore palladium more in detail and I will give you the information in the next class. So for today's class, aurum and argentum will come under chilly and platina will come under hot. So this will be the thermals. Okay. So two small topics we have discussed. One is the side affinity and the other very important thing is thermals. Anything else? Any other headings that you need to think of? Somebody was talking about dialysis. Okay. Dr. Krishna Das. See, specifically if you just look or if you read those four remedies, when you look at hemorrhages, out of the four noble metals that we commonly use in homeopathy, platina is the only remedy which is capable of hemorrhages, capable of producing and capable of curing hemorrhages. Okay. Now, where do we see hemorrhage in platina? Yes, very good. Mainly from uterus. Many cases of menorrhagia, you can think of platina. From your UG knowledge, What is the character of bleeding you have in platina? Black. Okay, dark. Dark hemorrhages. Hemorrhages which are partly clotted and partly fluid. The better remedy we know is Savina. But here, under dark clots, okay, if you look in your repertory, dark clots which are partly fluid, you have only two remedies. Platina and any idea which is the other remedy? Ferrum. Ferrum. So, blood clotted dark. Under that you have supplementary partly fluid. Platina and ferrum. Okay. Thick hemorrhages, dark hemorrhages, clotted hemorrhages. You see it in platina. Aurum, argentum, also has little amount of hemorrhage, but not very much prominent. So we are talking about hemorrhages. We spoke of style. We spoke of the thermals. Anything else? See, there are a few more images, few more things I want you to understand. Here is pain. Pain, I have two small headings for you. Okay, there are two small things. What is the onset of pain? Okay. It starts gradually and decreases gradually. Which is the remedy? Platina. So platina has that. And starts gradually and decreases suddenly. That is argentum. Hope I am clear. You know platina which had an onset which is gradual and it is decreasing also gradually. Exactly opposite to belladonna or many acute remedies. And gradual onset and sudden decrease is argentum. Okay? What is the character of pain? Noble metals, they have their own character. What is the character of pain you have in noble metals? Character. First very important thing is wandering pains. Shifting, aurum, argentum. Pains associated with numbness. Platina. Okay? Right? Pains which has a sensation as if they are enlarging. Again platina. Screwing pains, crushing pains. Argentum met has crushing pains. Mainly the testis. Crushing pains. Okay? So, wandering, shifting, crushing, okay? And then sensation as if it is enlarged. These are few types of pains we have in noble metals. Okay? So, we'll again have a quick revision in the end, but please keep the headings in mind so that we can come back. So character of pain is what we spoke. Any other contribution from your end? What would be the other general headings? Perspiration, okay. Unfortunately, nothing much related to... Okay, come close to what Vinod has spoken. We can talk of discharges. Discharges. Okay. Any quick inputs? How is the discharge in argentum? Very good. Starch. Thick. Discharges which are thick and they are starch-like. Argentum, metallicum. And what is the character of discharge you have in aurum? Aurum. Aurum has more of offensive discharges. And where are the discharges from? From the nose, from the ears, otoria, rhinorrhea, leucorrhea. They are very, very offensive. Okay? So platina, aurum, they have offensive discharges. Argentum, metallicum has more of starchy discharges. Okay? Any other remedies to keep the class alive? To keep the class awake? Any other remedies that you can think of? Discharges. Which are the other remedies which has a characteristic discharge? Any characteristic discharge? Calibrate, good. How is it in calibrate? Now what do you mean by stingy? Something that Yeah, there are many students who are doing action, something which can be drawn in form of a thread, but stringy. You also have another remedy coming very close, hydrosis, crocus whatever. But stringy. Any other discharges you can think of? Or what? How is it? Yes, mug. Very offensive. Yesterday in our IPD, we had a case of gangrene. Non-healing ulcer, gangrene, going towards gangrene, having very bad odor. What remedies can you think of? Arsenic, bacteria, okay, but yeah, creosote, decay. You can think of creosote, you can think of arsenic, or you can also think of murk, carboveg. Good. So they will have offensive asafoetida, they are offensive discharges. Okay. So discharges and after discharges, even many of the noble metals, they have leucorrhea. They have leucorrhea. Obviously leucorrhea aggravation, walking, leucorrhea daytime, these are few indications you have in the noble metals. Okay. So after leucorrhea, we can also talk of any other inputs. Desires, aversions. See, we are looking at the physical genders. I have retained this because this is the heading under which we are trying to explore noble metals. So desires, aversions. Again, from your UG knowledge, from your end, what are the desires of noble metals? Okay, sweets, argentum metal, their desires for sweets, good. Sweets, one, then alcohol, oil, okay, and palladium has desire for beer. Palladium has desire for beer. Okay, otherwise all the other remedies, they have desire for alcohol. Sweet desires milk and desires bread. Common desires of noble metal. One strong aversion noble metals have, and that strong aversion is aversion to meat. Aversion to meat. Or platinum. Aversion to meat in pregnant ladies. Platinum. Aversion to meat in pregnant ladies is platinum. Okay. Aversion in general to meat is aurum and platinum from the noble metals. Okay. So desires, aversions, any other headings you can think of? Think of the generalities and you can talk. The thirst. Thirst. Quick inputs from your end. 4 noble metals which are thirsty and which are thirstless. Aurum is thirsty. Platina is thirstless. Okay? Aurum and we are talking about aurum being thirsty and platina being thirstless. Thirstless. Okay? So this is to do with thirst. Sleep. Any idea? I know sleep comes from the physical genders, but keeping the metals, noble metals in mind, anything that comes up here? Bowels, very good. Thank you. I forgot there are 2 more things before I forget. I should keep because we don't have the PPT because of technical issues. Constipation, good, bowels. So when Dr. Krishna said bowels, 2 things should come to mind. Are noble metals constipated or do they have diarrhea? Noble metals are constipated. Now what is the character of constipation? Stools which are knotty, stools which are hard, and constipation in travelers and constipation in pregnant ladies. Hard, naughty, white is a different remedy. Hard, naughty, black is a different remedy. I mean, in homeopathy, stools are also, given so much of importance. I was teaching a remedy a few days back, and that remedy has designer stools. I know it is nauseating, but what you need to remember is one stool is joined by mucous thread, and then you have a stool, then you have mucous thread. For us it is very easy to explain, but imagine how complicated it is. Stool, mucous thread, stool, mucous thread. So that's why this is called designer stools. The remedy is graphitis. Okay. So stools, basically it is constipated, hard, tolerance and during pregnancy is more of platina. Hard, naughty, white stools is palladium. Hard, naughty, black stools is platina. Okay. So the little disadvantage of not having a PPT is we might tend to miss some points. When I spoke to you about discharges, one more very important thing you will have to add there is discharges are sticky. You agree now? Discharges are sticky. So what do I mean by discharges sticky? Adherent. So which is the noble metal which has sticky discharges? Platinum. Stool. Okay. Menses. Right? Even perspiration in platina is sticky. Stool adheres to the anus. Platinum. Anyway, when we talk about platina, we'll go more in detail. But sticky discharges, please remember. Okay? So constipation, now after constipation, you can also think of two more small organs. One is heart, and the other very important thing is uterus or the female genitalia. What do you think will happen on the heart? Argentum metal, aurum, platina, they have an action on the heart, and they cause functional disturbances. Like they can have palpitations, or they can have irregular beats. But aurum is a strong remedy which has an affinity for heart. Okay. Now what can aurum do acting on heart? It can cause valvular dysfunction, it can cause rheumatic heart disease, it can cause hypertrophy. A beautiful remedy. Okay, never miss aurums in heart. Okay, I don't want to tell on this platform aurum met is equal to heart issues. I don't want to conclude like that, but we have had beautiful results with aurum. And why I don't want to conclude aurum is equal to heart, because there are many more remedies in our materia medica which can do wonders, okay, when it comes to heart. So I don't want to, stop you in mind from thinking beyond. But aurum is one remedy. From my practical experience, from what I have learned from myself, my teacher, aurum has done wonders in heart. Okay? So heart. When I talk about uterus, I want a little of discussion here. What I am expecting from you is, which are all the noble metals which will act on heart that we have discussed, which will act on uterus, and what do you think they are capable of producing on the uterus? Okay, so you see tumors, you see fibroid. Okay, for example, even simple materia medica, if you read Allen, materia medica, keynotes, if you read Argentum, met, he talks of prolapse of the uterus. If we read Aurum met in Alan's keynote, he beautifully says prolapse. Prolapse from reaching something high, okay? Or, hypertrophy of the uterus leading to prolapse. Platina is also a beautiful remedy for prolapse. You also see prolapse in palladium, okay? So here it's very easy. All the 4 remedies are capable of acting on the uterus, producing or curing fibroid and tumors. Okay? And another area related to the female is ovaries. Ovaries, okay? Again, from argentum till platina, you see they can all affect the ovaries and it can give rise to tumors. Cystic tumors, chocolate cyst or ovarian cyst, PCOD, palladium, platina, argentum and of course aurum. All the 4 are capable of producing tumors. Okay. So before we conclude or before we close, now what is important here is we are discussing the physical generals of noble metals. Okay. And in that we started with the side affinity and we concluded that platina and argentum met acts on the left side. Aurum, palladium and argentum met again can affect the right side. And then we also saw the thermals. Platina is hot and aurum is chilly. Okay. And then we went to the next thing wherein we saw the pain, and under that we divided it into 2 small subheadings, onset and capital. So going gradually and coming down gradually was platina. Going gradually and coming down suddenly is argentum met. And we also explored the type of pain. Wandering, shifting, crushing, as if enlarged, shooting, with numbness, pains with numbness. Okay. See, numbness, before I forget, noble metals can also be a beautiful remedy for convulsions. If you refer those strokes, platina, mainly platina, though aurum and argentum also has some indication of convulsions, platina is a top remedy for convulsions. Platina. Okay. So convulsions, then we spoke of constipation. We spoke of hemorrhages. And which is the remedy which is capable of producing hemorrhage? Platina. And we also understood the character. Dark blotted. Dark blotted. Okay. Thirst and thirsty is more of aurum, thirstless is more of platina. Okay. And then what were the other ratings? Desires, aversions. Aversion was mainly for meat. And 2 remedies should come in bracket, aurum and platina. Desires, 4. Alcohol, sweets, bread, milk. Okay? What else? Beer, which is the remedy? Palladium. Very good, palladium. Okay. Its affinity for heart, all the 4 having an action. Aurum tops the list. Affinity for uterus, all the 4, and all the 4 are capable of producing fibroids. Ovarian cyst. Okay. Anything you would like to add? Constipation. The constipation. White, naughty, hard stools, palladium. White, naughty, dark stools, platina. Travelers constipation. Constipation during pregnancy. Again platina. Okay. So in next class, if things are clear, what we'll do is we'll try to take up the mind of the noble metals, and as an activity, we'll try to differentiate 4 noble metals. So that will complete the generalities. And we can also have the clinical indications that again can be an activity. Once we are done with this, we can quickly focus on individual noble metals. That's why we'll talk of let's explore. We'll start with palladium and then slowly move to the other noble metals. Okay? Done? Okay, chalo. Any questions or any additions? Clear?